Stroke is a focal neurological deficit, which is of no other origin but cardiovascular in origin.
Depression is the leading cause of disability. Depression on its own is a persistent feeling of sadness, a persistent feeling of hopelessness.
Hello viewers, welcome to this week's episode on Health Watch on Anglican Cable Network Nigeria. I am Angela Mwenze. Water, they say, is life, and every human requires sufficient of it to survive daily. According to WaterAid Nigeria, 59 million Nigerians, and that is 3 out of 10 Nigerians, do not have access to clean water. And we know that unsafe water is the source of so many deadly infections, which could lead to death in some cases. On today's episode, we shall answer the question, how safe is the water we use daily? Dr. Chich Aniagolu-Okoye is my guest today, and she's the country director for WaterAid in Nigeria. You're welcome to the program.
Thank you for having me, Angela.
It's good to finally have you here.
Thank you.
All right, thanks for coming. So now let's start with the statistics. Let's understand what is going on here. 59 million Nigerians don't have access to clean water. Then does that mean the other ones have access to clean water? Is that basically what this means?
Well, what it means is that if we're using the MDG, the Millennium Development Goal Standards, then yes, 59 to 60 million people do not have, because the standards were not as stringent as the SDG, the Sustainable Development Goals. If we use the Sustainable Development Goal Standards, then we're down to only 19%, because with 60 million, we're about 40%. We're down to 19%, which means that almost, that over 150 million people do not have access to clean water. And I need to explain that. You and I probably think that we have clean water because water is coming out of the tap.
I was actually very surprised when I did this, because I did a lot of research before this program, and finding that it came as a shock to me. I'm actually surprised.
Yeah.
You're just carrying what you're saying.
So a lot of us who have water running out of our taps think that because we have that means that we have adequate water. But I always ask the question, when last did you check your borehole, which is where the water is coming from? When last did you test your borehole, so the water from your borehole? So when we actually test the water from the borehole, it drops to about 90% or less, because even though we're in the urban areas and we have water running out of our taps, we're providing the water ourselves. When we drilled the borehole, we didn't get any expert to check the quality of the water. 20 years later, we're still drinking the same water, and we've never checked the quality of it. We had a case some time ago, some lady, water wasn't coming out of her tap anymore, and she wanted to know what was wrong, so she called someone. I don't want to gross you out, but there were like 3 or 4 dead rats in her
tank.
In the tank, and they had, they had blocked the pipe, so she couldn't get water, and she had been drinking that water for weeks and months with those rats in it. So when we talk about the quality of water, we're really talking about it for everyone, because most people think about it in terms of the rural areas or for slum communities and things. But even the people, who live in, urban areas and in highbrow areas in Nigeria also don't have good quality water.
So you're saying that could be getting up to 90%. Well, I'm not holding you to that stats, but
yes, I mean, then we definitely significantly increases. It drops down to 19% being the ones who have access to clean water. When you're talking about really good quality international standard water, maybe only about 19% of Nigerians.
Only 19% of Nigerians. Okay, so let me just take you on the borehole thing, because in my house I use a borehole. So I'm now thinking, okay, how safe is my water? When last did I check the tank? So the problem is not the borehole, drilling the borehole. The problem is, gathering it and not checking. Drilling
the borehole is also a problem. Because first of all, when you drill the water, you need to check the quality of the water. A lot of the water is contaminated. It's groundwater.
Okay.
And the groundwater, like Fela says, water has no enemy. So they all mix.
They take everything.
Exactly. They have no ethnic groups, or religion. So the water coming from Mpape will mix the water, coming down, to Maitama and the rest of it. So it's groundwater, and so you don't know where your groundwater has been flowing from. So you could be in a situation where your water, is contaminated by, chemicals from a factory, minerals in the groundwater, bacteria, things. So even when you're drilling, the best practice is that you're supposed to test the quality of the water to make sure that it is actually good water. So that's number one. And then after you have drilled and you have, your overhead tank, you need to check, periodically that the water is still good quality. You need to wash your tank, at least 3 times a year, to ensure that, the bacteria and the fungi that are growing in the tank are not there. So, and that's why we at WaterAid prefer that the water that comes to people's homes comes directly from the government, because the amount of work you need to do to keep your water clean, to keep your water, good for human consumption, it's a lot for the individual to do. And that's why in many other countries, it's actually a government that does it. But here, of course, a lot of individuals are forced to provide their own water.
Okay, before I go to ask, because what's coming to my mind is how we got to this crisis actually here. But before I get to that, I just want to take that over again. Well, we're in the crisis now. So if you're building the borehole, what is very important is to check the quality of the water when you're drilling. So it's not just you have a borehole, the water has come and hey, we're happy, there's water. No, you check the quality of the water. And then you check the water in the tank, at least clean up your tank, 3 times, as you said, recommended. If you can do more than that, that's fine.
Yes, of course.
Just that it's a lot more expensive if you're going to do it well. Yeah, because it's government function. Okay, so...
But I also need to say that the fact that you have bad water doesn't mean that you shouldn't drill, because I mean, you need to get water anyway, and that's the only place. All it just means is that, if you find that your water isn't very good when you drill it, then you now know that you need to get, water purifiers and get them cleaned up. Most times we only check for bacteria, but it's extremely important that we check for minerals.
Okay.
Because, if you have lead, for instance,
which is
in your water, that is really dangerous. And a lot of Nigerians are having cancer today, and we don't really know why. But I'm sure that if we do, we probably will be able to trace it back, to the things that we take in, and maybe the water. Maybe a lot of the water has lead. We don't know. That you don't have good water where you are doesn't mean that you should, not have water. You need to have water. Just make sure that then, you're able to identify, an expert to help, check the water and bring in the proper purifiers.
Okay, that's very important to say. And because I like the fact you talked about the lead. I think in Bayelsa State recently, and that region, they found out that the fishes, I think, had lots of lead in them because of the water it was coming from. And that area, there was just so many problems with the health of the people there. So I think that's an excellent point. Now, we're looking at 59 million Nigerians, or 59 to 60 million Nigerians who don't have access to clean water. How did we get to this stage in Nigeria that water, when I was doing the research and I watched a lot of interviews and lots of documentaries, I found out that it's a terrible case. In some places people actually scoop water, and I'm wondering, how did we get to this stage? What happened?
Well, I think it's very, it's a lot of things. But for me, I think that I would like to start by saying that it is a value that we place on the human person. That we don't talk about things like that, but I've come to realize that whatever it is that we do as a people is based on the value that we place on people. I always make the example that if you go to Apapa in Lagos, the only thing separating Apapa from Ajegunle is a road. Ajegunle is on the right, Apapa is on the left. All the facilities are in Apapa, Well, until recently when they started having the truck things. But in terms of infrastructure, Apapa definitely has more infrastructure than Ajegunle. Why is that? The people
just have a road between them.
And road between them. The people who live in Apapa didn't pay in advance to government for the infrastructure. They didn't.
Yeah,
the government put the infrastructure, people came and built houses. It's because of the value that we place on the people who live in Apapa and the people who live in Ajegunle. As a people, we have never valued our own. We don't value the poor. And that, for me, is the main reason that a lot of things are not, are not in place. It comes from our colonial history, where the white man provided just for himself. You know, so if you came to, Nigeria in the 40s and the 50s, under colonialism, you had the white quarters where all the facilities were. And then you had the African quarters that had less.
For things.
Exactly. And the people, unfortunately, those who fought for independence really were much more interested in getting the facilities of the white man than providing services. So for them, it was like, well, I want to live in the white quarters. They were not asking the question, but why does the African quarters not have facilities? So once they took over, they just continued to replicate exactly the same thing. So the rich areas continued to have facilities, and the African quarters and the African areas, just didn't have any facilities. If you ask a government official, they will tell you, oh, those places are illegal, they're squatters. So something like Ajegunle, for instance, is a squatter community.
But people are living there.
And they have lived there since independence or before. So why not formalize it so that you can provide, infrastructure? So for me, that's the most important thing. The first thing that, we need to value our people, and we need to be able to say, this is the standard that a Nigerian should not live below. Once we have a government that says my people deserve this, then everything becomes structured around providing that
for everybody.
Exactly. Yeah. A lot of times we say we don't have money, we don't have this. It's not really true. We know that where there is a will, there is a way. Yeah. There is no will. I think that's, for me, is the most important thing. The political will to change is not there, especially at the state and local government level. And the second thing, of course, is the widespread corruption. There was a World Bank study, I think 2 years ago, that showed that about 70% of the water schemes that are implemented in Nigeria go bad in the first 1 year.
Okay, so, they go back in the...
They go bad.
Bad in the...
Yes.
Okay.
So we don't have the facility. We get the money or we borrow the money. We build the facility. Within 1 year, it has broken down.
So low quality facility.
Low quality.
Not sustainable.
That's a major problem. Very, very low quality. Corruption. Sometimes even the boreholes that are put in communities don't get to the aquifer. It doesn't get to the water point.
Yeah, you have to travel. Is it the issue of travel? Sometimes they just build it in the center of the community.
Even when and
everybody has to travel.
Yeah, but I'm saying that even that, sometimes, the contractor doesn't even get to water. On the day of the commissioning, they go and get a tanker and fill it. And so the borehole is opened and people get water for that day, and then that's the end of it. So after that water, the pouring is gone, that's the end of no more water. The quality of the infrastructure is very, very poor, especially the ones that are done by government. So that's another thing. The corruption, the lack of the lack of monitoring and evaluation, putting in place a structure that ensures that the facilities are actually maintained. And it doesn't have to be a government official. If you put a borehole in a village, and you put together a village committee to manage that borehole, maybe they charge the people a little stipend to be able to fetch the water. That will be enough to maintain that borehole for 100 years, because the community has money and things to do it. So it's just the fact that there is no structure, and where there is a structure, it's broken.
Okay, when we come back, we're going on a quick break, but when we come back, we'll talk a little bit about population increase, how it has affected, just like what we're talking about. So we'll go on a quick break and we'll be right back. Thank right, welcome back, viewers. Before we went back, we were discussing the water safety, or how safe is the water, you know, you're taking. And my guest is still Dr. Chich Okoye. Thank you so much for how much you've spoken to us about. Okay, let's go back to the population. We're talking about what was responsible for this water crisis in our country, Nigeria. And we're looking at the population of Nigeria has increased. I don't think we know exactly how many we are right now. Some people say 180 million, say 200 million. So with this population increase, wouldn't that be a problem with, catching up, the government catching up with, the increase in population in Nigeria?
I have to say that I am not a population reductionist, because I really try to look at I do country comparisons.
Okay.
If you look at the United States of America, a family of 4, because of their lifestyle and the way they live, will consume more water than a family of 10 in Nigeria.
Yeah.
Most people don't have showers in Nigeria. They'll take a bucket of water, they will have a shower, they'll take a bucket of water, they'll flush their toilet. So waste is really not that much. So what an American will use in a year, one American might be what 20 or 40 Nigerians will use.
Yeah.
So in terms of providing infrastructure, I'm not certain that the population is a proper argument to make.
Okay. Okay.
Nonetheless, I do agree that if your family is overpopulated, if you can't provide the resources for your family, then that you need to do something like that. But I think that when the government makes an excuse about the population is growing, yes, I do agree that the population is growing, but planning is what you need. And for me, if I look at Togo or Republic of Benin, where they are, a tenth of what we are, they still don't have resources. They still don't have, there are still places there that don't have water, that still don't have proper sanitation. So the fact that they are small hasn't made them, more efficient. So the thing is that, we can try and blame everything else. It's the population, it's this, whatever. But what you need is proper planning. Because usually if you lay a proper, good quality pipe for water, and you do a big water scheme, most times it produces 10 times more than the people can consume.
Of course, yeah.
So the population is a problem maybe for other things. But when it comes to water and infrastructure, I think the issue really lies in the government's ability to plan. Because I think that even when we were half of this population, not everybody still had water. In 1960, when we were 60 million people, a lot of people still didn't have water. So and I'm sure that if we ended up being 20 people in Nigeria, there'll be some people who wouldn't have, water, because then there won't be enough money to pay for it, because there are only 20 people. So we have the population, which should really be an advantage if we had a government that was really thinking about how to harness the population, and really thinking in terms of infrastructure and having a process for recouping the money. How many times do you receive your water bill? Sometimes in a whole year you get nothing. Yeah. And so they can't even get their own money back. So the problem, is not everything else. It is in being able to put in place the right structure, a monitoring and evaluation plan, a collection plan, and making sure that you're actually piping people, so that you can get your water, get your money back. So
the bulk of it is the government at the end of the day not providing what needs to be provided for its citizens.
That's my argument anyway.
And I think I agree with that. All right, I want to also talk about the dangers of bad water, unsafe water, or unhygienic water, the dangers of it. Because we're in the problem already, so we're trying to see how to let people know that, somebody, like I was saying off the camera, I watched a documentary in Enugu somewhere, you had the feces was collected and dumped in the water, and just about 2 kilometers from that water, that's the stream water, and another family, they're drinking of it, having their bath of it, and they're cooking with that same water. And I'm wondering, How possible does this happen? Well, what it is what are the dangers of bad water? It sounds obvious. It looks like an obvious question, but some people really don't know the dangers of bad water that they use.
I totally agree with you. I think that just like you said when we started, water is life. And so many of the things that we are suffering from in terms of health really have their origin in bad water. So if we're talking about diarrhea, dysentery, cholera, Ebola, Lassa fever,
typhoid. Typhoid, yeah.
I mean, malaria, because it's the environment also.
Allows them to breathe.
But so many things can be prevented if we had good water and sanitation. So many things. And so the amount of money we spend on healthcare, the kind of budget every year, people are demanding for the government to increase the budget for healthcare. I think it's important to have good hospitals. But I think I'd much rather that people didn't go to hospital, didn't need to go to hospital in the first place. And so we are not looking at prevention. And I think it's a developing country thing. We really wait until everything is broken. But with water, it is such an easy solution to many of the healthcare problems that we have. What even makes it worse is that our healthcare facilities don't have water. So you can go to the hospital with malaria and come back with typhoid. You could go to a hospital, and get cholera in a place like that. So even the healthcare facilities are not providing adequate water and sanitation. So, I mean, there's so many things that we can prevent if we could just think in terms, of providing good quality water, to people in their homes and in facilities. I think for me, the most embarrassing is government, of offices. You go to government offices and you can't use the toilet because it's not working. In one of the states where we work, the Ministry of Water Resources does not have water. And so, I mean, no matter how small your budget is, can you not just, just the fact that you are the Ministry of Water or the Ministry of Environment, can you not have water so that people come in there and they can say, oh, this is the standard that we should. You can't use a toilet, you can't get water. I think there is, we are really in a major crisis.
And because even the average Nigerian don't even remember that there's a ministry like the Ministry of Water Resources. That's to show you how bad it is, because we don't even remember. I don't think I even thought about the Ministry of Water Resources until you started, speaking about it. So water is really, important in whatever we do, and we need the, clean water. Okay, back to still the people watching. How can we at least manage the water that is already bad? How can we manage it for now, hoping that one day we'll get it right? But the average Nigerian watching is sitting in the house right now thinking, well, my water is bad. I'm using borehole water. I haven't cleaned it for about 2 years and I've been using it. So what can we do?
Well, the first thing to do is to test if the water that you're using is good. Okay. So if you're somebody who is lucky enough to have a borehole, the first thing is to look at the water. There are a lot of, if you go on the internet, there are companies that do water testing. Yeah. So you could get your water tested. So at least that's the first thing you can do. What is the quality of my water? And the people who do the water testing can tell you what to do to be able to clean the water. I think that for me is the quickest and the quickest thing anybody can do. And then to wash your tank, just go and open that tank and see what's in it. For some people, algae has been growing in it. People who are using, whose tanks are metal, probably all rusted inside of it, so just go and look at the tank and see, what the quality of it is, and then test the water. I think that's the quickest thing anybody can do at this point in time. And if you're in a community, in a rural community where you have to go and go to a public place to get water, again, the people who manage and maintain that need to test the water, because it's even worse for rural communities, because most times they don't even boil the water, because they can't afford the firewood to be able to boil their water. as well as cook. So they have to make, they have to make choices. And again, for the people who have boreholes, of course, something else that you can always do is to boil your water. That kills at least 70% of the things, it will not take care of the lead and the, heavy metals if you have that, but at least the bacteria and the pathogens that can, it will take care of that. So boiling water is something else. Communities really need to start investing in testing the water, because they are the ones who really, suffer from cholera. Every year in Nigeria we have a cholera outbreak, which is a disgrace, really, because it just shows that we have poor water and hygiene practices. That's what cholera is all about.
And I was just going to ask use of disinfectant, especially for bathing, but I'm now thinking people in the rural area, disinfectants are really expensive.
There are natural disinfectants that you can use as well. There's some plants, we can't get into it now, but there's some plants that you can use to disinfect your water. There's coal that you can put in water. Because a lot of people know about alum.
That's one, the alum.
So there are ways in which you can actually, you can also use very fine sand. But those are simple technologies, that probably be, you will need to get a technical person to talk about that. But there are simple ways in which you can purify your water, even in rural communities.
Okay, I want us to talk about toilets, because anytime I read anything or while doing this research, when they talk about the safety of the water or how bad the water is, the next thing you see is the toilet issue. But we're going to go on another break, and when we return, we'll talk more on the toilet issue and water. We'll be right back, viewers. Welcome back, viewers. Before we went on the break, we were still talking about the safety of water in our environment, and my guest is still Dr. Chich Okoye. All right, so before we went on the break, we wanted to talk about toilets. What's the relationship between toilets and the safety of the water we're drinking?
Well, there's a strong relationship between water and sanitation. You'll find, of course, that most places that don't have water don't have good sanitation. They go hand in hand. But increasingly, we actually realize that sanitation is perhaps even more important, because a lot of people will be able to find a way, to get water, but most people will just openly defecate. And of course, we're all connected. So during, you defecate in the open, the rains come, they take the water, they take your defecation straight into the stream or into the groundwater. It pollutes your water, you drink it. Sanitation is so important because, again, a lot of the illnesses that we have come from poor hygiene and poor sanitation. If you remember when we had Ebola, everybody was asked to wash their hands, and we did that religiously. Most people, they were just doing it because everybody was terrified, but nobody actually thought of the fact, can you imagine that washing my hands can prevent Ebola? So can you imagine how many other things that, that you could prevent by just washing your hands? So that's important. But the toilets is extremely, extremely important, because first of all, we can't end open defecation if we don't have toilets. People need to have an alternative, to open defecation. And we find that the statistics are even lower. With Nigerians, I think at the last count, only about 20% of Nigerians had adequate toilets.
Wow.
And the thing is that even for the people who have toilets in their homes, once you leave your house, we don't have public toilets. You don't have, you find a lot of people, especially men, urinating on the streets. So even though you have a toilet in your home, you are still subject to open defecation because the facilities are not there in the public. And the implication of open defecation, for us is that, again, it has to do with health. It has to do with the dignity of the human person. It has to do with the level, of civilization that we want to say that we are. I mean, we really can't be talking about a country that wants to develop, where millions of your people are defecating in the open.
In the open,
yeah. Nigeria is the second largest country for open defecation. India is number 1. India has almost, I mean, they put in place a state of emergency. They've done so well, and the indications are showing that in the next, few years, they will be able to eliminate open defecation because they've really had a huge program to get their communities, and individuals to get toilets. So if India, if
such a large population,
yes, if they're able to succeed, Nigeria will become the number one country for open defecation, and we're not anywhere near trying to fix it. But I must say that the federal government has done very well. 2 years ago, or last year, they declared a state of emergency in Nigeria.
Yeah, I think I read that.
And the federal government, has put in place a national action plan, and is really trying to follow the roadmap to try and get Nigeria off the, on the path for stopping open defecation. And I have to say that personally, I'm very excited that the minister, the former minister, has been returned to the Ministry of Water Resources, because he did a lot, to try and put that state of emergency in place, and he is somebody who really gets it, So we're really excited that he's back, which means that we're going to have continuity and a lot of the plans, because Water Aid works very closely with the Ministry of Water Resources, and a lot is happening. The only drawback, of course, is the implementation of water and sanitation is within the mandate of the state government. The federal government can only put in place policies and support. It is the responsibility of the state government to provide facilities on the ground, and unfortunately that is not happening in most states.
So the people can actually demand from their state government, because you just look at the federal government as the ones who do everything. But because I like that information right now, the responsibility of providing toilets to the citizens is the job of the state government, and I think the local government as well come in place here when it comes to providing water and good sanitation for the people. But I read an article, I think it's also on the Water Aid website, and it says that disgust is not really what is the motivating factor for toilets. I think people do it with pride, because it's pride. I don't know if you're aware of that article or something. I know the thing was, because people, defecate outside, doesn't move the Nigerian man to build a toilet. He's built a toilet because he wants to show that he has a good toilet and he's very foreign. No,
it's very interesting, because I was talking to a colleague from another organization, and they were talking about the project they were doing in northern Nigeria, somewhere in northern Nigeria, and they had come at it from the health perspective and talking to people about, how having toilets in their homes could prevent a lot of illnesses, and nobody was paying them any heed. So they had to go back to the drawing board, and then came back with the a new strategy and a new advocacy, and really telling men that it is a shame to have a wife who goes to the toilet, to the bush, to do their their thing. And can you imagine what it is like, if a young man or somebody is watching your wife? That did it.
Oh, okay.
That did it. A lot of people were like, oh my God, and that was really what motivated people to start, putting in toilets. The idea that, and that goes back to the original thing I was talking about, the value of the human person.
Yeah.
By focusing on how they value their wife and how they see their wife and how they see their status and how they see themselves as husbands and providers, that was what they had to tap into to be able to make that happen. And we're following that. So I think it's extremely important in any community to say, what is it that motivates people? Because really most times it is not need that motivates people, it's want, that motivates people. So you need to tap into the wants of people to be able to get them to change their behavior. And ultimately, they will get to see the benefits. The important thing is, first doing it. And then people then recognize that, okay, this is important. I have to say, that it will be an unrealistic expectation to expect the state or rural or local governments to provide toilets for everyone who doesn't have it in their homes. So I think it's important for people to recognize that the responsibility of owning a toilet is theirs.
Okay.
You know, you're not going to ask the federal government to buy you clothes, you know what I mean, or the state government. But what we're saying to the state government is that it is their responsibility, you know, to provide the enabling environment, to get the private sector to be interested, to subsidize these toilets for the poorest of the poor, and also to provide toilets for the people who are completely at the bottom of the pyramid. There are people who don't own toilets, but who don't own toilets, but who can afford it. They just don't do it. I mean, in one of the states where we went to see the village chief, and he doesn't have a toilet in his house.
So where does
the
this
chief
thing?
He goes to the bush.
Oh, okay.
Because as far as it's concerned, that's where you do your thing. When, you know, the staff were leaving, he gave them 40,000 naira as a gift for going, and they didn't need it. And we're like, okay, we'd much rather you take this 40,000 and put a toilet in your house. So it was not that he didn't have money. You know, he just didn't believe that it was something that was necessary. So that's where the government can also come in, really begin to sensitize people. Everything is not huge billions of naira. You know, just every state has a radio station and a television station. Most of the time, you know, they're playing silly music. You know, why not use that time to really advocate and you know, do jingles and do adverts, you know, that really help people, you know, make the right decision. Everybody today, almost everyone owns a phone.
Yeah,
you know,
you can send off.
It wasn't the government that gave them phones. They recognized the need for it, and they saved money or begged for it or whatever it is that they do. And a lot of people have phones. You know, there are a lot of toilets. Again, people don't actually know the toilet options. What's Raid, you know, in partnership with Lixil, an American company, and Innocent in Nigeria, are producing these toilets that cost only the toilet pan themselves, you know, are less than 1,000 naira. You know, they're called sato pans. Okay. You know, and we're training artisans in the states and things, you know, to be able to produce, to fix these things and fix them properly. So it's not as expensive as people think, but most people don't know about these options, and we're trying to get people to know about them so that they realize that it doesn't cost that much, you know, to own a toilet. But, you know, I have to keep saying it is a responsibility of government to change attitude, you know, to make people do the right thing. And then a lot of times, unfortunately, that is not where the government's, you know, priorities lie.
Which is quite a shame.
Indeed.
It's quite a shame, the government, what they're doing. Well, I'm sure there's so many people learning right now that toilet is not as expensive as you think it is, you know, but it's very important. It's very important. I don't know how to put it, what other word to use, but I think toilet, I believe now that the toilet thing is very important, because you don't know who you're harming by going to defecate in the water. Because I know I think in Katsina or somewhere in the north, they have this big lake. They all use, they defecate in there, they drink there, they wash there, the tankers come and take the water there, and I'm wondering, wow, we're just, you know, recycling. It's just not a northern thing. Yeah. All over Nigeria, it's the same thing. All over Nigeria, rural communities depend on rivers, you know, that they defecate in and they drink from, and the rest of it. It is a catastrophe. And like I said, at least the federal government recognized that, put them in a state of emergency. We're pleading with state governments to replicate that. Every state, you know, should announce a state of emergency, and I think Edo State has done it, so we must commend them as well. You know, they've put in place a state of emergency. It is a crisis, you know, because if we look at how many children we lose, you know, infant mortality is so high in Nigeria, and a lot of the time the children have diarrhea, dysentery, or cholera. Actually, so that about 59,500 children die every year from water-related. Not every year; it's every day. Every day. Yes. Wow. So, oh God. You know, so it's yeah. I mean, we really need to have some level of responsibility, and like I said, these are not huge budgets. You know, being able to tell communities of simple solutions, being able to get health workers, you know, not to focus just on cure, but on prevention. You know, when mothers come for the antenatal, they should be taught, you know, good hygiene,
about water. Communities should have water. You know, healthcare centers should have water. Schools should have water. We haven't, and we're talking about sanitation. You know, there's a study that has shown that a lot of girls miss school during their menstrual period because most schools don't have adequate sanitation.
I think I saw that. Yes,
exactly.
Yes.
So can you imagine if it's during exams and you're in your period?
Yeah, you can.
And then you go to, and you can't go to school because there's no toilet, there's nowhere for you to, so you miss school. A lot of girls miss 5 days every month. 5 days every month of school because of inadequate sanitation. Multiply that in the school term, and then you can understand why, you know, some girls are not doing as well. What does it take to build a toilet in a school? You know, how do we commission a school that has no toilet? You know, I mean, it just makes no sense at all. And we are looking at a next generation, you know, that is supposed to be empowered to be able to make a difference in the country, and people are being raised like animals.
Yeah. And oh God, I can just go on about this. Okay, so let's talk about the water we drink, the bottled water, the sachet water, which is, I think there are more people consuming the sachet water than the bottled water. Is it, I don't know how safe that is. That's the question. I don't even know how to put the question, but is it safe?
Well, I think you need to be asking that question to NAFDAC. They are the ones who are licensing and monitoring these things. But one thing I can say to you for a fact is that, you know, beyond the safety bit, which I can't speak about because, you know, we're not testing the water, but we know that water in plastic is toxic. So, and then the thinner the plastic, the worse it is. So the people who are drinking pure water, you know, first of all, many times these sachets are in the sun. And so, you know, we know that, you know, they become more and more carcinogenic as the sun, you know, beats down on the plastic and releases a lot of the chemicals that are used in making. As you know, plastic is a petrochemical. And so it sips back into it. So, which is why many times I tell you, even if you're going to have water in a plastic, you must always be in a cool place. You know, how many of us, you know, we're buying water in the market. The thing has been sitting out there. The kids who are selling it, exactly, it's exposed to the sun, you know. And so just the fact, just from that angle, whether or not, even if it's good quality water, the fact that it is constantly exposed to the sun means that it is contaminated. You know,
even if it's clean, even if it's pure, as the name implies, when it's been exposed.
Exactly, to the sun. And so a lot of people, you know, more and more we're being told the best way to preserve your water, if you're lucky enough, if you're part of the 5% that gets water from the government mains, take your water, boil it, put it in a glass bottle and store it in your refrigerator. If you don't have a refrigerator, just store it outside, but put it in a glass bottle as opposed to plastic. Because plastic, like I said, you know, degenerates.
That applies to even the sachet water and the bottled water.
Exactly. Exactly. Yeah.
Wow.
Yeah.
That's a very huge information we just got out there. Yeah. Because when you look at the waters, they're always under the sun. Yes. When you go to the market, the water, nobody keeps it inside. And I think it's because people don't even know that by putting that water outside under the sun, it's dangerous. So I think anybody watching that's storing water somewhere, please don't put it under the sun. If that's the information we can take away, don't put it under the sun. Keep it somewhere, you know, inside. So, you know, you don't.
I mean, I don't want to take money away from hawkers because they really need the money. But that's not the best place to buy water. You know what I mean? You know, if you must buy plastic water, you know, buy it from a shop that has air conditioning, and take it from there and put it in a cool place in your house.
Okay.
That's it only, because if the water was transported from Lagos or things like that all that way, I mean, it's already exposed to the sun. But at least in terms of what you can do as a person, you know, you make it worse when you further expose it when it has come to you. And also water in the car. You know, you shouldn't have bottled water in the car because then the sun you know,
So don't put water in the car. Your plastic.
Except you have a bottled water. If you have a bottle.
Okay.
Glass.
The glass bottled water.
Glass bottled water you can keep in the car.
I was younger, that was what we used.
Yes,
the
indeed.
bottled water. I don't know how we changed. I don't know how we
It's cheaper
changed.
to make plastic.
Yes, yeah, to make plastics, and we just keep,
And
bottles
it's more durable.
Yes, it is. It is. So I don't know how we just changed.
Switched, yeah.
Switched. But the glass water, the bottled water is best. But the one that the rubber bottle, the sachet shouldn't be under the sun. Yeah, and shouldn't be in the car.
Yeah.
So take it out of the car and keep it, or go in with it.
And you can use the sachet water for everything. Use it, I mean, if you're in a place where you don't have water, use it to wash your vegetables, and you put salt and things, but, try not to drink it if you can. It just isn't the healthiest way to consume water.
Okay, let's talk about water aid. Water aid, well, you've been the country director for how long now?
A little over a year now.
Over a year, okay. That's because I know you've been with Oxfam. Girls Effect. You were the country director for Oxfam, Girls Effect. And now, so you've just been country director for so many things, which is really cool. Okay, so what's Oxfam? I say Oxfam, no.
WaterAid.
WaterAid.
Well, WaterAid is a leading international organization, for water sanitation and hygiene.
That's the WASH.
That's WASH in short. And basically, what we do in Nigeria is we are working with government to try and improve access to water and sanitation for people. In Nigeria, we're focusing a little bit more on sanitation because, like we said, the statistics is a lot worse on sanitation. But we also recognize that we're a small organization, even though we're in 38 countries in the world, and Prince Charles is the president of WaterAid. But we recognize that, compared to the problem, as a small organization, we can't make the kind of difference and impact that we can, but government can. So what we do now is that we partner with government. We're working with the federal government, but we also work in 3 states. We work in Enugu, Bauchi, and Plateau State. And we're working with those governments to put in place the necessary, policies, roadmaps, plans to be able to, provide adequate water and sanitation for the people. We also carry out physical projects, so we will put in boreholes and small water schemes in partnership with other people. We have a project that had just started in Enugu, where in partnership with Coca-Cola, where we're making a water scheme, in Suka and a few other communities. And basically, but the way we're doing it now is to use those things as demonstrations. Like I said to you, the quality of water schemes is very poor in Nigeria. So we know that we can't put water in every community that needs it. But what we're doing is to say, okay, we'll take a community that really, is in dire need. We will provide the facility. So whether it is a borehole or a small town scheme or something like that, and in partnership with the government, we work with the rural community, the small town, or the rural, or the Ruwasa, depending on what community it is, and we work with them to be able to put in place a facility that we know will last the test of time. So the government officials are also learning, how to do a proper borehole. So the schemes we do now are more demonstrations than really being what it is that we're doing. And in Bauchi State, we have really been able to work with the government, to put in place plans, to put in place, structures and really work on getting the government, to provide better facilities. So that's the core of our mandates. That's what we're doing now. We also work with the federal government to try and put in place, the right policy. There's the Water Week happening in Stockholm, and we're working with the Ministry of Water Resources to have a breakfast, or rather to have a closed-door meeting with important stakeholders in Stockholm to look at, the Nigeria situation and to try and get them to support Nigeria's water and sanitation sector. So because of our international reach, we're able to get the kind of audience that maybe the government will not be able to reach. So those are the kind of things that we do. But ultimately what we want is for communities and people to have better sanitation and better water, so that their health outcomes are so much better.
So much better. Well, I know I read a lot about you, and I saw so many. You've been in Ireland. You've been a lecturer in Ireland, and you know, living that kind of, you know, environment and coming to Nigeria to do all what you're doing. How has the response been from the government? You know, you're putting a lot of effort trying to get them, and I like what WaterAid is doing. You know, you set a standard, and somebody can see it. Even other people, I know on the website, people can donate. You know, as little as I think $2, and you know, you can really help a lot of homes. So, you know, how's the response from the government been?
Well, at the federal level, like I said, it has been fantastic. The former minister, who is now the minister, you know, Suleiman Adamu, you know, was really great. I mean, most times what we, as international organizations, you do a research, and you say that, you know, 40% of Nigerians or whatever statistics don't have access to things. The first reaction you get from government is to deny it and begin to argue about the statistics. But he was completely different, because as far as he was concerned, you know, where will the World Bank or WaterAid anybody say that what is isn't? And he immediately ran with it and said, well, if this is the problem, let's try and fix it. And that's the way government is meant to be. And you know, he was instrumental to the declaration of the state of emergency. He was instrumental to the road plan, to the national action plan. So a lot of what needs to be done, you know, he helped do. And that's why, like I said earlier, I'm really excited that he is coming back to that ministry. You know, so these are the kind of things that we need to you know, to put in place, to have a government that is responsive. You know, don't start arguing about whether the statistics, whether it's 20% or 10% or whatever it is. You know, the issue is that there is a problem. And let's fix it.
Fix the problem. Okay. Thank you very much for coming on the program. I wish I could keep asking questions, but we're off on our time. Thank you, and I hope, you know, I think with what you've just said, with the response of the government, at least there's hope somewhere in the future. So, and I hope as you keep working with them, things will pan out well, since you're there.
We're still pleading with the state government to come on board.
Yeah, to come on board.
And do the right for their people.
And they will at some point, I'm sure.
Some states have, like I said, Edo State has. I think Ekiti State has also started doing something. There are some states that are, Bauchi State, we've had a fantastic relationship with them. We're not working in every state, so it's not like like we know what's going on elsewhere. But I think that, you know, if the state governments were putting in 10% of the resources into water and sanitation, we'll be able to see, you know, significant, and let them just, starting from their own ministries, you know, can there be water in state ministries and good sanitation? It's an embarrassment when we have foreign visitors come to Nigeria and go to a ministry and they want to use the bathroom and it's a mess.
Water.
You know, we really, really need to ask government, you know, I know they don't see this, they're much more interested in the bigger things, but, you know, the people access you by the small things, and it's ridiculous not to have a toilet.
All right, thank you very much for coming. And like I said, charity begins at home. So let's start from home.
Thank you, Angela. Thank you
so much, Dr. Chichi, for coming on the program. And that is all we can take for today. Please, we'll see us next time when we come on the program. My name is Angela. Goodbye.